Welcome to the Omni Dental podcast.
Glad to be here.
So imagine walking into a clinic because, well, you have an impacted tooth that needs an immediate extraction.
Ouch. Yeah, that's not a good day.
No, not at all. And you sit down in the waiting room and you notice the person to your left is like getting hooked up to an intravenous vitamin drip,
Okay.
while the person to your right is looking over pigment swatches for permanent makeup.
Oh, wow.
Right. It sounds like two entirely different realities just colliding, doesn't it?
It really does. It sounds like you walked into the wrong building.
Exactly. But today, we're doing a deep dive into an organization that is actively blurring those very lines to fundamentally change how we interact with medical professionals.
Yeah.
We're looking at the extensive service directory for Omni Dental of Arlington Heights, alongside this really revealing blog post published on April 29th, 2026.
Right, by Dr. Bayless Poles.
Yes, their lead practitioner. And the post is titled Omni Dental's Community Outreach Highlights. And really the mission of our deep dive today is to explore how a modern practice bridges that gap between, high-tech clinical services and genuine grassroots community trust.
What's fascinating here is that when you look at the raw data of what this clinic does, alongside Dr. Poles' writing on their community outreach, you see a massive shift in the whole philosophy of healthcare.
Yeah, totally.
Because for decades, the traditional medical model in this country has been purely reactive and heavily siloed.
Right, you wait for something to go wrong.
Exactly. You wait for a catastrophic failure like a blinding toothache or a broken crown, and then you go to a very sterile, intimidating building to have a purely transactional procedure.
Yeah, which is just a terrible experience for everyone. I mean, evaluating a dental practice purely by its clinical tools is kind of like evaluating a restaurant only by looking at its kitchen appliances.
That's a great way to put it.
Like, sure, you have a really expensive oven, but how do you actually treat the neighborhood? Are people happy when they leave?
Exactly. There is a lot the listener, can learn from this model about the actual future of accessible healthcare.
Because it truly is a duality here. You have the absolute peak of modern clinical technology sitting inside a physical building.
Right.
But the text makes it clear that the technology is utterly dependent on very human ground-level outreach outside the building.
It is.
But before we get to the outreach stuff, we need to establish the scale of what they're actually doing inside their facility.
Oh, it's massive.
Yeah, so the clinic is located at 305 E Rand Road, led by Dr. Poles, who brings over a decade of specialized experience in dental injuries and emergencies.
Right.
And the sheer breadth of services under one roof is just immense. You have the foundation of general dentistry,
Yeah.
cleanings, fillings, root canals, sleep apnea appliances.
The basics. Yeah.
But then you get into the heavy-duty restorative procedures.
Right. We are talking about highly complex structural interventions. They offer all-on-4 dental implants, which is really a biomechanical marvel if you think about it.
It really is.
Instead of replacing teeth one by one, they use 4 titanium anchors surgically placed into the jaw to support an entire full arch prosthesis.
Wow.
And they don't outsource the foundational work for that either. They handle the necessary bone grafting right there in the clinic.
Okay, let's unpack this because the term bone grafting gets thrown around a lot on medical menus. But what does that actually mean for a patient sitting in the chair?
It's essentially structural engineering for your mouth.
Oh, interesting.
Yeah. When you lose a tooth, the jawbone underneath it no longer receives the pressure and stimulation of chewing.
Right, because there's nothing pushing on it.
Exactly. So the body assumes that bone is no longer needed, and it literally begins to melt away.
Oh.
Yeah, it's a process called resorption. So if you want to put a titanium implant in later, there isn't enough structural integrity to hold it.
It's just too weak.
Right. So a bone graft involves physically adding bone material to the jaw to build up a sturdy foundation. It's almost like pouring deep concrete footings before you build a skyscraper.
That sounds intense.
It is. It requires a highly sterile environment and an expert understanding of skeletal anatomy.
Okay, well, this is where the service directory takes a massive left turn.
Yeah, it does.
If I'm looking at a clinic that does complex skeletal grafting and emergency root canals, it is wild to keep scrolling and find a massive aesthetic services wing.
Right.
I mean, they offer Botox and dermal fillers, sculpture treatments, microneedling, laser pigmentation removal. They even do acne scar treatments.
And they push it even further than facial aesthetics.
Yeah.
The directory includes systemic wellness and body treatments, things like cellulite reduction, laser hair removal, and that IV drip therapy you mentioned earlier.
Right. They even do permanent makeup.
Yeah,
Microblading for eyebrows, lip blushing, nipple pigmentation, and scalp micropigmentation.
it's a huge list.
And they operate Monday through Friday, 10 a.m. to 6 p.m., casting a massive geographical net. I mean, their service footprint covers Arlington Heights, Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Duplain, and Elk Grove Village.
That is a massive suburban sprawl.
It is. So I have to push back a little here. Why would a family dental office dealing with medical emergencies across all those towns expand into body sculpting and lip blushing?
It seems strange at first.
On paper, it reads like someone mashed a surgical center and a day spa together.
If we connect this to the bigger picture, it actually makes perfect biological and psychological sense.
Okay, how so?
Let's look at the biology first. In modern medical aesthetics, the face, the smile, and overall physical wellness are deeply interconnected systems.
Right.
Think about the cranial nerves, specifically the trigeminal nerve. That's the primary nerve responsible for sensation in the face and motor functions like biting and chewing.
Okay.
A dentist navigates that incredibly complex web of nerves and musculature every single day. They give precise injections in the most sensitive, highly vascularized areas of the human head.
That is a phenomenal point. If somebody's going to inject a neurotoxin like Botox or a volumetric filler into my face, I absolutely want the person holding the needle to be the same clinician who intimately knows my jaw structure.
Exactly. Who knows where every single nerve pathway sits?
Precisely.
They also offer platelet-rich fibrin, or PRF, therapies.
What is that?
This is where they draw your blood, spin it in a centrifuge to isolate your own natural healing proteins and stem cells, and then reintroduce it to accelerate healing.
Oh, wow, that's cutting edge.
It is. A dentist might use PRF to heal the jaw after a complex extraction, but that exact same biological mechanism can be used in aesthetics to rejuvenate skin tissue. Offering all of this under one roof utilizes the same advanced clinical technology.
But there is a psychological layer to this too, isn't there?
Oh, absolutely.
Because earlier I joked about the surgical center and the day spa being mashed together, but I think that might be entirely intentional.
I think so too.
People generally associate getting a facial or an IV drip or Botox with luxury, with pampering. It's self-care.
Right.
By placing those services right next to tooth extractions, Omni Dental is actively trying to rewrite the brain's association of the dental clinic.
That's spot on.
They're shifting the environment from a site of potential trauma to a site of wellness.
That is the exact insight. They are capitalizing on the immense trust patients already have in their provider.
Yeah.
If you trust Dr. Poles to safely perform a bone graft, you inherently trust that environment for an aesthetic treatment. It elevates the standard of care across the board.
But that brings us to the central tension of the materials we're analyzing today.
Right.
You can have the most advanced centrifuge for platelet-rich fibrin. You can map every cranial nerve perfectly. You can have a beautiful facility serving 10 different zip codes. All of those resources are completely useless if the community is too paralyzed by fear to actually walk through the front doors of 305 E Rand Road.
Which is the reality for millions of Americans.
Sadly, yes.
Dr. Poles' April 2026 blog post directly confronts this friction point. Omni Dental doesn't just sit in their high-tech clinic waiting for the phone to ring,
Right.
because they know that a massive percentage of their target audience is actively avoiding them. The article highlights 3 primary reasons families delay visits: immense fear, cost concerns, and a basic lack of accessible information.
Here's where it gets really interesting. Think about how we view preventive healthcare.
Okay.
Most people view a skipped dental cleaning as a minor issue. But let's look at it like a city's levee system holding back a river.
I like this analogy.
A tiny structural microfracture in the concrete, which is essentially what a cavity is,
Yeah.
doesn't look dangerous on a sunny day. But the mouth is the gateway to the entire body. When a storm surge of bacteria hits, that microfracture fails, the infection spreads, and suddenly you aren't just dealing with a bad tooth, you're dealing with catastrophic systemic flooding.
Yeah, the biological reality is that untreated oral infections are directly linked to cardiovascular disease, respiratory issues, and severe diabetic complications.
Exactly.
This raises an important question. How do you treat a patient who is so intimidated by the levee repair process that they flat out refuse to call the engineer?
That is the big question.
Because the evolutionary biology of dental fear is intense.
Oh, for sure.
Having a stranger put sharp, loud instruments into your airway while you're lying horizontally on your back, it triggers a deeply ingrained vulnerability response.
It's terrifying.
You cannot simply hand someone a brochure and tell them to stop activating their fight or flight reflex.
Right, you can't logic someone out of a biological panic response.
You have to bring the care to them. You have to dismantle the clinical intimidation factor before they ever need a drill. You have to prove that your team represents a safe harbor. And you achieve that by physically leaving the clinic and meeting the community on their own turf.
Which leads into the specific tactics Omni Dental outlines for this dismantling process.
Yes.
If you want to stop a massive fear of the dentist from taking root, the most effective place to start is with children, right? Long before the anxiety pathways in the brain are permanently mapped.
Exactly. The blog post details how Omni Dental makes school visits a core priority.
Okay.
They leave the clinic and go directly into local classrooms. And they aren't going in to perform exams, they are going in to teach highly accessible, fun lessons about brushing, flossing, and the impact of healthy food choices on the body.
I hear that, but I'm going to play the ultimate skeptic for a minute.
For it.
Sending highly trained, highly compensated medical professionals out of a lucrative clinic to go do a presentation about flossing in an elementary school gymnasium seems wildly inefficient.
It sounds like it, sure.
I mean, we all know kids are told to brush their teeth by their parents every single night. Is sending a dental team into a school actually moving the needle on community health? Or is this just, a good PR strategy to get the Omni Dental logo in front of suburban parents?
That skepticism is fair, but it ignores the difference between having knowledge and applying knowledge.
Okay.
Yes, every child is told to brush their teeth. But a child's compliance with health routines is entirely tied to how they feel about the process.
That makes sense.
By normalizing the presence of a dental professional in a classroom, which is a child's established safe space, Omni Dental is actively breaking the psychological association that dentist equals pain.
So it's less about teaching the mechanics of a toothbrush and more about exposure therapy.
It is entirely about rewiring perception. They are taking the clinical white coat out of the terrifying office with the glaring overhead lights and the high-pitched mechanical noises and bringing it into a familiar environment. They are building early confidence. Think about the long-term payoff. When that child eventually has a toothache and actually has to sit in the surgical chair at Omni Dental, the battle is already won.
Yeah, because they already know them.
The child isn't fighting a scary stranger. They're interacting with the friendly person who played a nutrition game with them at school. It fundamentally shifts the trajectory of that child's lifelong compliance with medical care.
That makes the logistics totally worth it. You're diffusing the bomb before the timer even starts.
Exactly.
But children only make up a fraction of the population avoiding the dentist. Adults carry an immense amount of this medical trauma, too.
Oh, absolutely.
And they're usually the ones passing the anxiety down to their kids. So the outreach has to encompass the entire family unit, which brings us to the broader grassroots events Omni Dental participates in.
The April 2026 text emphasizes their heavy involvement in health fairs, charity drives, and neighborhood wellness programs across towns like Palatine and Mount Prospect. And again, they are doing more than just handing out branded lip balm. They are offering free dental screenings and actively sponsoring community health initiatives.
There's a phrase used in the text that seems small but feels incredibly vital.
What's that?
It says they answer common dental questions in relaxed settings.
Yes.
That addresses a massive socioeconomic barrier to entry. I mean, if you have a weird lingering pain in your jaw, making a formal appointment, figuring out your insurance copay, taking time off work, and asking a doctor a question while a bib is strapped to your neck.
It's an inherently stressful, high-friction process.
Exactly. But asking that exact same question to a dentist who is standing at a booth during a sunny Saturday charity drive, the friction is completely gone.
It lowers the barrier to entry to almost zero. The text highlights that these simple pieces of accessible advice, combined with early, low-stress physical screenings, are what actually catch structural issues early.
So what does this all mean for the patient?
Good question.
Well, I think of it like changing the oil in your car. It's a small, cheap, easy habit that prevents the catastrophic, expensive failure of the engine down the road.
That's a perfect encapsulation of the economics of prevention. Creating a human connection with a patient at a community event long before they actually sit in the dental chair proves something vital to you, the listener.
Yeah.
It proves that a business investing its own operational resources into neighborhood preventative health is genuinely prioritizing your long-term wellness over their own short-term surgical profit.
Right. Because if they were only motivated by maximum profit, The smartest business move would be to stay inside the clinic, wait for your tooth to completely rot out of your head, and then charge you thousands of dollars for a complex extraction, a bone graft, and a titanium implant.
Exactly. Let the problem get worse so it costs more to fix.
But instead, they are standing at a health fair in Wheeling, trying to give you the exact information you need to prevent the cavity from forming in the first place.
Mhm.
That is how you build unshakable trust.
It transforms the dynamic. You are no longer just a vendor and a consumer. You become true partners in community health.
Which brings us to a really powerful synthesis of everything we've unpacked today. Omni Dental isn't just a physical address in Arlington Heights, packed with advanced centrifuges for platelet-rich fibrin and specialized lasers for pigmentation removal.
No, it's not.
It is a living, breathing community partner striving to make the entirety of healthcare approachable, affordable, and fear-free.
And for you, listening to this deep dive right now, we live in an era of absolute information overload.
We really do.
You can open your phone, search for a local provider, and get 1,000 highly targeted results in a fraction of a second. But what these sources prove is that finding the right healthcare provider is about much more than scanning a menu of services to see if they have the latest technology.
Absolutely.
It is about finding a practice that actively works to dismantle your fear, prioritizes patient education, and values the trust of the neighborhood just as highly as their clinical precision.
I couldn't agree more. Now, before we wrap up, I want to leave you with one final lingering thought.
Okay.
There is a very specific detail buried in the About Us text that we haven't touched on, but it is incredibly provocative. The sources note that Omni Dental operates as an environmentally conscious dental practice.
Oh, right.
They are explicitly committed to minimizing their environmental impact through sustainable practices and reducing medical waste.
It is a fascinating inclusion, especially when you consider the sheer volume of single-use plastics and chemical compounds typically required in a sterile surgical environment.
Right. So think about the operational loop here. If this clinic is already deploying teams into elementary schools and local health fairs to proactively protect the community's oral health,
Yeah.
how does their internal commitment to reducing environmental waste protect the community's overall health?
Oh, that's a great point.
Does the physical health of the local environment, the water systems, the air quality, the soil around Arlington Heights and Buffalo Grove ultimately loop right back into the biological health of the very patients they are trying to save?
It strongly suggests that their definition of preventative care isn't limited to just the human body. It extends outward into the ecosystem that supports those bodies.
Exactly. Something to really chew on. Because at the end of the day, having the most technologically advanced surgical suite in the world doesn't mean a thing if the local environment is toxic and the people living in it are too terrified to walk through your front doors.
Well said.
It all comes back to how you treat the world outside your walls. Thanks for joining us on this deep dive. We'll catch you next time.